I'm Dr. Vinton, and welcome again to the Vinton Method. Now, as you saw potentially on the home page, we said that we would have a breakdown of how the Vinton Method applies to different conditions. These conditions, such as shoulder pain, torn rotator cuffs, degeneration of the shoulder, right, frozen shoulder, hip problems, knee problems, osteoarthritis, problems in the elbow or the wrist or the ankle, any joint in the body, including the spine, but we'll save the spine for the back page. Now, how the Vinton Method applies is, again, we have 6 physicians, 3 medical physicians and 3 doctors of chiropractic. But the Vinton Method, again, is a head-to-toe evaluation. It's all connected. And it's an evaluation that maybe 1 in 10 or 1 in 20,000 physicians might even consider performing. As a result, once we've determined what the cause or causes are, and sometimes the cause is remotely removed from the actual pain. So the other thing, by having a pain management specialist, if you remember we discussed in the other video that only 6 out of 132 medical schools actually teach a class specific on what is pain and how do you treat it. So by having pain management on staff, by having different doctors on staff, we're able to look at this thing and see, is it a mechanical issue? Is it just simply osteoarthritis? Is it autoimmune, right? Like a tic or Lyme's or lupus or something, or rheumatoid arthritis, which has a different cause than osteoarthritis and requires a different treatment. Is it something that's neurologic? Is it something caused by stenosis, whether you have back pain or not? Is it caused by stenosis in your spine, right? Is it caused by a metabolic problem, right? Inflammatory problem, which eats away at the cartilage and causes the joints to swell and become painful? Or is it a combination of all of those? So we can do all the things your family doctor or your orthopod might recommend, right? Cortisone, which we've probably discussed elsewhere on this site, and if not, you'll look in the research article sections and you'll see we don't use cortisone. It has been evidently clear since at least 2015 that every shot of cortisone further causes damage to the cartilage and to the ligaments, accelerating the arthritis. And if you go take a post-MRI, you will physically see more damage to the joint just from the mere fact of getting the cortisone shots. Doesn't matter if it's the Xarelto or the delayed cortisone, it's all cortisone. It all has the same effect. In addition, let's assume cortisone actually worked for you, and now you had 2 or 3 or 4 or 6 months of relief. But now you're walking around just grinding those bones together. You just can't feel it till the cortisone wears off. Therefore, you've now caused more arthritis. So the fact of getting cortisone, the research is very clear, and again, the articles are on this site, very clear that it accelerates the need for a joint replacement by 6 months to 2 years sooner than if you didn't have cortisone. So we don't use cortisone for that reason. But there's ablations where they can burn the nerve. The name brand of one of those is called Coolleaf. I'm not exactly sure how it got through the FDA because, so it works for about 60% of people. They go and they burn the nerve in the joint. The problem is that, let's assume it did work and you get 6 to 10 months of relief before the nerve grows back. Well, in that 6 to 10 months, you're just grinding your joints away. You just can't feel it. So when it wears off, you now have more physical arthritis and you're still headed towards a trajectory of having a joint replacement surgery. So there are different therapies and knee braces and things along that line. Some people take different supplements, but here's the deal. When you wear out of cartilage, right? So when it's gone, when the tissue is gone and you need new tissue, there's really only 2 ways to get that tissue. So we have tools that can decompress or stretch the joint, and that can be helpful after we've applied some other treatments to help the joint to recover. But in and of itself, it's not going to make a difference. Those things you see in the infomercials where you put the red light on your knee, again, it might feel good while you're using it or maybe an hour afterwards, but in the end, your tissue is destroyed. Your fluid is dried out, your cartilage is cracked, arthritis is setting in. So all of those things might provide some relief, like the aspirin creams and the biofreezes and maybe a methotrexate or some kind of medication, but none of that regrows the tissue. So you're still maybe slowed it down a month or two, but you're still headed towards a joint replacement. So then we move into the regenerative medicines, right? PRP, platelet-rich plasma, is amazing. But PRP is primarily designed for soft tissue injuries, tennis elbows and strained meniscus. It'll give certainly some temporary relief, but it won't help you grow new tissue. So as we move down the list of 12 or 15 options, every option that exists on the planet, we offer. Most physicians, most orthopedic doctors, you have cortisone, gel shots, maybe some therapy, and then you're right into surgery. They tell everybody that they're bone on bone. In reality, as long as you can still move your joints, so if you're sitting down, you can extend your knee out in front of you, like you're kicking a ball or doing a leg extension, we're able to help. That's our cutoff. The person who can no longer move their joint, there's nothing left but a joint replacement. So when we get to the end stages, see, there are 4 stages of osteoarthritis of the knee, the shoulder, the hip, any joint in the body. Stage 1, 2, 3, and 4. So like the lubricant, the gel shot works very well at a late grade 2 or very, very early grade 3, and that should get you 6 months to a year, maybe 2 years of relief. But if you're a mid to late grade 3, the gel shot no longer works. And not that it people always say, well, it didn't work for me. Well, if your doctor, if you're at a 3.5 or 3.7 in terms of degeneration, and your doctor gave you that injection, it's not that it didn't work. It never had a chance to work because it's only meant for a very, very early stage of arthritis. If your arthritis is middle or late stage, it's not going to help. So what happens is most physicians have those 3. They have the cortisone, the gel shots, the surgery. Some clinics offer PRP. Some clinics, so that's 4, very few, just maybe a few hundred clinics across the U.S. offer a 5th. Nobody offers 12 to 15 options, let alone look at other parts of the body, like a dropped arch in the foot, which can cause knee pain. Looks at the lumbar spine, or actually we do a full person exam to see, is there any other issue? Meaning some people, their whole spine is sitting off to one side, causing strain on one side versus the other. And when that postural deviation is corrected, their knee pain goes away. Other people have just significant, like a 3.8 out of 4 damage, in which case then we use regenerative medicine. So, and there's very few clinics that actually do that. So by having 6 physicians, by having over a dozen potential options, we're able to do things that most physicians, certainly most orthopedic doctors, aren't able to do. They go right into surgery. What they don't tell you is that knee replacement or shoulder replacement surgery is about a 50-50. Half work very well, and the other half don't work well at all. People still have a pain of a 4 to a 6. You know, when they do a rotator cuff repair, 81% of those re-tear. When you do a knee replacement, 50% of people still feel pain of a 4 to a 6. You can't climb a ladder, you can't kneel down, let alone if you get the infection. Or they don't tell you that there's a 3,100% increased risk for a heart attack during that surgery and for the first 30 days after that surgery. So there's a lot of risk and a lot of downside. If it goes well, fantastic. But if it doesn't, it can lead to lifelong disability and pain. So by having and amassed a dozen possible options and being able to do everything your doctor can do, and then we just don't have 4 or 5, we have a dozen. We've studied all over the world. And by looking for the root cause, utilizing the Vinton method, we're able to determine. We just had 2 yesterday who their knees were beautiful. They were like an early stage 2. Theirs was clearly coming from another part of their body. We identified that. We began to correct that. and their joint, in this case their knee, began to feel significantly better. Same thing with the shoulder. Maybe 1 in 10, maybe 1 in 20,000 physicians would even look at the cervical spine, even though the nerves exit the neck and go out into the shoulder. So it makes perfect sense in the Vinton method to go from the top of the head to the bottom of the feet. Everything is connected to see where the actual deficit is that's causing the pain. Sometimes it's right where you think it is, and sometimes it is not. And therefore, rather than guess with your health and well-being and your dollars, we do the full exam. We spend a full hour together to locate the cause or causes, and then we work at correcting it. So whether, let's assume we did something like regenerative medicine, like let's assume we even use stem cells, right? It's amazing. The Mayo Clinic has an entire regenerative medicine program based just on this. So what makes us different than maybe one of the other clinics? And there aren't many, but one of the other clinics doing stem cells. Well, most other clinics aren't doing stem cell therapy. They're actually using an umbilical cord or Wharton's jelly. That was actually made illegal by the FDA a few years ago. So they're operating illegally. And the fact is there are no stem cells in those products. So there are growth factors. There are certainly some things that can help stimulate growth, but there's no stem cells. The only legal place in the United States to do stem cells is to do a bone marrow aspirate. So there are two ways to do that. The old way, which was incredibly painful both now and for decades into the future, and the new way. The new way is how we do it. Technology is amazing. It's nearly painless. You feel pressure, but you don't really feel pain to have it performed. And once it's done, versus the old way, you don't feel pain the next week, the next month, the next year. So it's much more comfortable to have be performed. Number two, and this is huge, regardless of what we do, if it involves an injection, and part of the 12 methods, there's some that aren't injectables. There's other things we might do, none of which involve surgery. But if we are going to inject something, it's always done under a fluoroscope. Feel free to look at some of the videos below, and you'll see how the fluoroscope allows us 100% placement. If you inject a shoulder without a fluoroscope, your chance for missing the joint is 55% or greater. Your chance in the knee for missing the joint is 25% or greater. So even if somebody else promised you a wonderful injection, if they're not using a fluoroscope, and 95% of physicians do not, then you're getting what's called a blind injection, and your results are automatically 25 to 55 or greater percent less than we would achieve, because we always use a fluoroscope. In fact, we have two of them. A small one for small joints and a big one for larger joints. So in addition, all of our procedures are done by a trained medical physician, not by a mid-level, a nurse practitioner or physician's assistant. So as a result, the standard of care is higher than something you might find as a side offer in a doctor of chiropractic's office, or that you might find in a physician's office where they have a nurse practitioner or a physician's assistant perform the procedure. In addition, the gold standard in our office and in the medical profession is 4 injections. So a lot of my acquaintances and colleagues might do a single blinded injection for the same fee that we might charge, a single blinded injection, whereas we do the 3 or the 4 injection model under fluoroscopic guidance, which is there's nothing better on the planet. And because we've done the full person evaluation, we're aware of any other deficits, which we're also working on to maximize your success, both short and long term. So again, the Vinton method, by looking from head to toe, by having more than a dozen options, which is twice as many, well, 4 times as many as the average standard physician. And then again, if you went to the Mayo Clinic, which is the #1 medical facility in the world, they do have an advanced regenerative medicine degree. We follow the 4 injection model if we're going to go that direction. But again, there are a dozen options. And of that dozen or so, 8 or 9 of them are all pretty standard, covered by major insurances. If we should move into regenerative medicine, if that's what your body requires, if the damage is so great that you need new tissue, there's only two ways to get new tissue. You either cut it off and replace it with the known side effects and potential dangers, or we inject it with your own stem cells and grow your own tissue. Now, the Mayo Clinic did a study and they wanted to know, did you actually grow new tissue, or was it cheaper tissue like a scar tissue? And they found out without a doubt it's brand new tissue, just like when you were an infant. Number two, how long did it last? Most studies are 6 months or a year, some are 3 or 5. This was a 15-year study, and they compared a joint replacement with having your own stem cells. And for the first 6 or 7 months, it was about the same reduction in pain and increase in mobility. But starting in month number 7, all the way through the 15 years, at every point in time, and by a significant margin, the group that had their own stem cells had significantly less to no pain, and their mobility was significantly better. In fact, in the group that had the knee replacement, 60% had a second replacement because the first one wore out. Whereas in the stem cell group, once it regenerated and renewed the tissue was like it was 20 or 30 years ago, as evidenced on x-rays and MRIs. So, not saying that you're going to need stem cells. What I'm saying is that we have a dozen options. We have options that you've never thought of. It's not necessary to try to explain on the phone or try to look it up on the website, because your exam will tell us what you need. And then our trained doctors will choose from that dozen or 15 options to the 1 or 2 that are specific to you. Once we know that, we'll have an in-depth conversation, because we have an hour's appointment will be set aside to go over all of this. So we know that because we have a full head-to-toe exam, which nobody does, because we have 6 physicians of different specialties, because we have studied worldwide, and this is all that we do, and we're able to offer 3 or 4 times more options than your standard physician or your orthopedist, right? Remember, orthopedics do surgery. That's what they primarily do. I mean, they may try to give you some things along the way, but in the end, you're going to have surgery. If your goal is to avoid having surgery, understand you need to get off that train, because that train only leads to one station. Whether that surgery happens this year or next or 3 years from now, that system always leads to surgery. If you want a different option, we have to do something to change the trajectory away from that, and that's what the Vinton method does. So whether it's a shoulder, whether it's a back, whether it's a hip, whether it's an arthritic knee or wrist or elbow or foot, we have solutions that are not commonly found. That's why people travel from all over the country to visit our office and to achieve results that they were not able to achieve closer to home. So that is the thrust of what the Vinton method is. Just call the number, schedule your no cost and no obligation evaluation, and find out what your options are. Everybody wants to ask on the phone, well, what are my options? Well, really, there's 12 to 15. There's too many to discuss. That's what the doctors, it's not something you're going to figure out on your own. It's something that took us 35 years and working 10 and 12 and 14-hour days, traveling the world, investing millions of dollars to figure that out. That's what our doctors uniquely do. And once we know what the issue is for you, you'll get a score on damage, right? There's 4 stages of arthritis, so it's 1, 2, 3, 4. So what works at a stage 3 does not work at a stage 3.3. And what works at a 3.3 will absolutely not work at a grade 3.5. If you have a secondary issue like a back issue or dropped arch issue or some other inflammatory issue or whatever it is, we'll uncover that. And again, something 1 in 10, maybe 1 in 20,000 physicians is even aware of. Most are just, they just do the cortisone, they just follow the standard quo. They may do the gel shot or recommend some therapy, but they're really waiting around for you just to have the surgery. If your goal is to avoid it, you need to get off of that train and onto a different train. We look forward to seeing you at your evaluation. Feel free to view this site. A copy of our book is here. There's articles here. There's a plethora of videos here. But really, how we make it specific to you is during your evaluation, we'll determine what exactly is happening inside of you. Then we'll have a detailed discussion about the way to fix it. So you'll see some generalized stuff but really it comes down to, and I get, you may have a specific pain. We're most interested in what is causing that, and if there's more than one cause of that. And once we're done, I think you'll be very pleased, as our patients are, which is why they leave so many 5-star reviews. And the bottom line is that's why 50% of our practice travels from out of state every day, and we look forward to helping you.